My name is Dr. Dom, and I'm a medical doctor board certified in psychiatry and child and adolescent psychiatry. So a really important topic, guys, bipolar disorder, a very real mental illness that can be very debilitating for individuals that suffer from bipolar. Now, what is bipolar disorder? Well, first of all, I want to say something right off the bat. The bipolar is not just mood swings, and you tend to hear that all the time. This person's bipolar, that person's bipolar, and it's because they have mood swings. Well, I'm here to tell you right now, as a board certified psychiatrist, that is not what bipolar is. Bipolar disorder is an illness, it's a mood disorder where people don't have the usual ups and downs of the average person. What happens is they end up in what's called a manic episode and or a depressive episode over time. Now, manic episodes are debilitating. Now, the definition of a manic episode is this. Think about this for a second and how serious this is. 7 days straight, at least 7 days straight, which is a long time, of feeling with an unbelievably elevated mood, a grandiose perspective. Some people believe they're gods, some people believe that they're rich, some people believe that they have superpowers. I'm not kidding, this is real. You become very, very distractible. You can become very irritable.
Meaningful, momentous, and nonsense.
Okay, I'm gonna get you a bit more Ativan to settle you down.
I don't need to settle down. Tell him!
People in a manic episode tend to be very fast with their speech, fast with their actions. It almost seems that when you talk to somebody who's currently manic, it's almost as if they're run by a motor that's in high RPMs. So everything is very, very sped up, and combine that with no need for sleep. So a person experiencing a manic episode will often tell you, I don't need sleep, I'm good. Now, the challenging thing about a manic episode is that people tend to feel pretty good when they're in a manic episode, so they won't seek help. The people that usually seek help when they're experiencing a manic episode are brought in because their family, loved ones, and caregivers see this behavior. But a true manic episode is exactly what I just described, and when you see it clinically, it's very powerful. So in order to be diagnosed as a bipolar 1, which is bipolar 1 disorder, it means that you've had a manic episode, those symptoms that I just described, for 7 days straight, at least once in your life. And if you've experienced that, then you probably can be diagnosed with bipolar disorder. And there's a lot more to the diagnosis, of course, ruling out any medical problems that might contribute to this, of course, ruling out substances that can cause mania. There's a lot of medications that can cause that experience as well. So making sure that we're ruling all of that out is very, very important. And also ruling out other psychiatric disturbances are part of the diagnosis as well. But in order to be diagnosed with a manic depressive disorder or bipolar 1, you've had to experience a manic episode. Now, I don't want to confuse you, but there's also something called bipolar 2. Now, bipolar 2 means that you have manic episodes in a similar fashion to bipolar 1, but they're not as long. They don't last for the full 7 days, and it's usually about 4 days or so. And the mania, those grandiose flight of ideas, pressured speech, all of those attributes of mania are a little bit more tuned down, and it doesn't affect your life too significantly. That's called bipolar 2. The other thing to remember with bipolar 2 is that in order to have that diagnosis, you also have to experience a depressive episode at some point. Now, again, not to confuse you, bipolar 1 is a manic episode in your life ever. Does not have to have depression, but can. Bipolar 2 is the hypomania, 4 days less manic, but does have to have a depressive episode. Now, really important, guys. People also think that bipolar looks like this: manic, depressed, manic, depressed, manic, depressed. And that's just not true. That's a myth. When someone has bipolar disorder, they can be manic, back to just being normal, what we call euthymic for a long time, manic again, then maybe back to being euthymic. Maybe they get depressed later. So it doesn't have to be this sine wave of ups and downs. It's really delineated by those manic episodes. Now, get this. We consider someone to be rapid cycling, meaning someone that has lots of episodes of bipolar, manic, and depressed, if it's more than 4 episodes in a year. So think about that for a second. We're not talking daily fluctuations in mood. We're talking fluctuations in mood that last weeks at a time for extended periods. And anybody that experiences those for 3 or 4 times in an annual time period, that's called rapid cycling. So it's just to put things in perspective for everyone out there that calls people bipolar or uses it superficially. Remember, mania is really debilitating, and the depressive phase of bipolar can be unbelievably debilitating as well. We have some amazing treatments for bipolar disorder now. If you or a loved one is experiencing some of these symptoms, absolutely seek professional help, and it can be addressed appropriately. Bipolar disorder management. So if somebody is diagnosed with bipolar disorder and you have a friend or loved one, or you're experiencing bipolar disorder yourself, hopefully you have professional help that's helping you deal with this. But I do have some tips and thoughts about how you can manage your bipolar disorder. Well, number one, we have some really good medications that can actually help with what we call mood lability, those going into that manic episode or going into a very, very depressed episode. We have medicines that are actually called mood stabilizers, and these mood stabilizers will do just that. They prevent those manic episodes from happening, and they can even prevent some of those really depressive episodes from happening. So making sure that you stay with your medications if you truly have a bipolar disorder are really, really important. What we tend to see is actually in bipolar disorder, when people feel good or when people feel euthymic and they're not on a manic episode or they're not in a depressed episode, they'll stop their medicines. And that can be problematic because it can lead to more manic or depressive episodes. So maintaining your medicine, following up with your doctor appropriately at regular intervals is so important in keeping those manic and depressive symptoms at bay. So a lot of people think that psychotherapy might not be helpful for bipolar disorder, but that's the farthest thing from the truth. We actually know for certain that good cognitive behavioral work with a good psychotherapist can allow you to understand your emotions and understand some of these negative thoughts or false beliefs that you have and work through them with a good psychotherapist. And this can be unbelievably beneficial for anybody dealing with bipolar disorder. So the psychotherapy component is incredibly important. I also want to add that bipolar disorder is very sensitive to physical circumstances in your life. And what I tend to see as a doctor who works in the emergency department and the psychiatric emergency service is when people aren't getting sleep, when they're not taking care of themselves, when they feel burnt out or overworked, it can lead them into a manic or a depressed episode. So really paying attention to your life, sometimes keeping a journal of your mood is really important, and paying attention to triggers. And one thing that we tend to see pretty readily is that when your sleep cycles start to become a little bit erratic, that could be a potential trigger to pay attention to. Maybe talk to your provider about there might be a manic or depressive episode coming.
Rooting for this Hemingway guy to survive the war and to be with the woman that he loves, Catherine Barkley.
It's 4 o'clock in the morning.
So recognizing those triggers. And I think also what's really important, and I like to do this with clients that have bipolar disorder, is putting together a crisis plan with the patient, client, and their family, if they're open to communication with their family as well, because sometimes these manic episodes come on pretty suddenly.
I'm bipolar.
Really?
And sometimes the depressive episodes come on pretty suddenly. So you want to have a crisis plan in place. Who do you call? Which doctor do you call? Which emergency department do you visit? And a lot of emergency departments have psychiatric crises departments, which are great. So putting together a crisis plan is also very important in individuals that suffer from bipolar disorders. So yeah, I love movies and I love to watch acting and portrayals. And sometimes I do see, as a behavioral health professional, some pretty poor portrayals of actual mental illness. And something that I also see from time to time is a sort of superficial naming of bipolar disorder. And what I see is sometimes people, the average person might say, oh, that person's having mood swings, so they must be bipolar. Well, that's really not necessarily true. Or if somebody seems maybe unstable with their moods, maybe they have erratic moods, that they're automatically bipolar, and that might be portrayed in the media or even in cinema. The truth is that people with bipolar disorder really struggle with something called mania and depression. And mania is a very significant aspect of that illness where it's not just mood swings, it's getting into a time frame for 4 to 7 days straight where you're grandiose and pressured with flight of ideas. You can even be delusional for that time period. You tend to do things that you normally wouldn't do, be very, very impulsive, and it's an extended time. We're not just talking an hour or two, we're not just talking minutes. And I think that's what people get wrong the most, is that bipolar disorder is sort of a fixed time frame of a manic episode and a fixed time frame of a depressive episode. And they don't necessarily have to be ups and downs like this. They could sort of wax and wane. You could be manic for weeks to months. You could be normal for weeks to months. So kind of throwing those terms around that somebody is bipolar just because they have mood swings, or someone being portrayed as bipolar just because they have some ups and downs, really aren't accurate. Thank you so much for watching. Click here to subscribe and click here for more.